As the demand for nursing labor continues to be a priority for hospitals and health systems, it's imperative that nurse leaders think outside of the box and take back agency in how patient beds are staffed. Hi, I'm Lindsay Gove, Enterprise Account Manager at Medely, and today I'm excited to discuss with you the 4 ways that per diem nurses can actually help drive hospital revenue to reduce the use of expensive overtime, help revenue-driving units keep up with demand, and prevent overspending on recruitment efforts, all while ultimately giving hospitals more agency and flexibility in how and where they spend to staff their units. Today's hospitals are using more flexible contingent labor and per diem nurses because of the high costs and limitations that come with travelers and recruiting and retainment efforts. Using per diem nurses saves time and money and helps get facilities full-time coverage with more flexibility. Number 1, per diem nurses help reduce the use of incurring expensive overtime. It's convenient for hospitals to use per diem nurses because they can hire only when they need coverage, as opposed to forecasting out months in advance in order to attain a traveler or a full-time position. The first thing they often do is offer overtime to their permanent staff, which can lead to burnout and churn when a facility is relying too heavily on its current staff to fill those gaps. With a flexible solution like Medely, leaders can continue to offer overtime to their core staff first and leverage Medely as a secret weapon to easily fill the gaps of coverage without running the risk of becoming short-staffed. Number 2, per diem nurses can help the most revenue-driving units keep up with patient demand. In some hospitals, the most revenue-driving units are ER, OR, and most recently, behavioral health. Medicare and insurance dollars are going there, and they tend to be the most profitable. Many hospitals are in the red because the units that impact their bottom line and drive the most revenue are struggling to maintain consistent coverage. Keeping up with the demand in those units not only helps provide the best possible patient care, but also keeps money coming in for your facility so you can keep treating the patients that need your help. Number 3, per diem nurses can prevent revenue going towards costly recruitment, training, and retention efforts. At Medely, we know that keeping those units staffed can be the most challenging, so adding per diem nurses can ensure that regardless of any callouts or surges in cases, there's always ample coverage. Recruiting, training, and retaining full-time staff is the most expensive aspect when it comes to staffing a hospital. When you add per diem nurses to your workforce by using Medely, you can book those nurses only when you need them. With Medely, you can build up a pool of favorites, which allows you to continue working with a dedicated extended workforce, which ultimately saves you money, time, and effort on those extensive recruiting processes, training, and retention efforts. Number 4, per diem nurses give hospitals flexibility and control over spending. With full-time staff and travelers, hospital leaders are paying them whether their units are busy or not, which gives them less control and agency over their staffing spending. If leaders book per diem nurses with Medely when they need them most, they can pull back or increase spend on contingent labor when it's most critical for their units. As the demand for nursing labor continues to be a priority for hospitals and health systems, it's imperative that nurse leaders think outside of the box and take back agency in how patient beds are staffed. Medley's per diem bookings are the fastest and most reliable way to build out and manage an extended workforce that helps drive revenue and control labor spend. Thanks for watching. Go to the description to learn more about Medley, and please leave any comments or questions below.